The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
You're listening to the 5-Second Rule, brought to you by APIC, the Association for Professionals in Infection Control and Epidemiology. Together with our nearly 16,000 members, we strive to create a safer world through the prevention of infection. Join us while we talk to infection preventionists and other experts to learn the truth about some common myths related to the risk of infection and to get tips to keep yourself and the people around you safe from infection.
Hey everybody, welcome to another episode of APIC's The 5-Second Rule. We are coming at you live during a global pandemic of COVID-19. Before we get started, some sad news. My co-host, Hannah Andrews, has moved on to a bigger and better gig. We miss her here at The 5-Second Rule and wish her well, and I know for sure she's still listening and learning from all of our episodes. So Hannah, big shout out to you. We are going to be talking about COVID-19 on today's episode, but specifically COVID and infection prevention in the long-term care and nursing home settings. They've been hit very, very hard. I can't imagine anybody out there isn't aware of this, but just in case you have been for some reason, I don't know, off the grid or living under a rock, you may not know that according to the Foundation for Research on Equality, nursing home residents account for upwards of 42% of COVID deaths. That's a lot. We know also that the nursing home population right now is hovering somewhere around 1.5 million, and in 2030, it's expected to grow to 5.3 million. And that's according to an article from 2016 in Nursing Economics. So why are these numbers so important? A large percentage of our population lives in these long-term care assisted living settings. They are, for the most part, elderly or individuals with a lot of medical conditions. And so they are prone, or more prone than you and I, us healthy folks, to get healthcare associated infections. And so to help us understand why this is and to help us understand how we can make positive changes and improvements to this population, we have two of APIC's finest guests with us today. Angela Vasala, who's a nationally recognized expert in infection prevention and epidemiology. She is the co-founder of COVID Smart, which is an infection prevention online education program for the general public, so be sure to check that out. She also serves as the associate faculty at West Coast University for undergraduate and graduate Masters of Public Health programs. She is an APIC Fellow and is currently the chair of the APIC Communications Committee. Welcome, Angela. We also have Evelyn Cook. Evelyn Cook is the Associate Director of the North Carolina Statewide Program for Infection Control and Epidemiology. By the way, that stands for SPICE, which is a very cool acronym. She's the Principal Lecturer of all SPICE infection control courses and leads applied research projects in infection control and epidemiology. Welcome, Evelyn.
Thank you, Sylvia. It's good to be here.
So, ladies, we have a lot to talk about. I mean, we probably can't get to everything related to healthcare-associated infections in long-term care in one episode. But let's focus in on what's happening during this pandemic, during COVID. I started out by sharing with everyone that, oh my God, 42% of deaths are within this population. Angela, talk to us a little bit more. Help us understand what we mean by long-term care, assisted living, nursing home. Are they the same? Are they different? And it's my understanding as well that, you know, this issue of infection control goes back a while with this setting. So at least help the audience understand what we mean by all these different terms.
Sure. So the first thing I can say is, unfortunately, this world involves a lot of acronyms. So there's LTC, long-term care, and that's the general umbrella for everything. That's long-term care. So think of that outside of the hospital where people stay for a long time. That's the way I look at it. There's long-term acute care, which we call LTAC, and that is a hospital-type environment, but long-term. Then we have nursing homes, or what we refer to often in healthcare as SNFs, skilled nursing facilities. And there are different types of skilled nursing facilities. There's some V-SNFs, those with ventilators, which means a little bit higher level of care, specific training of staff to manage ventilators. And then there are distinct part, or DP, skilled nursing facilities, and those are nursing homes that are basically part of a hospital. They're either a separate wing with a separate license or across the street, but they usually tend to be associated and close to a hospital. And then we have home health, assisted living, a myriad of other things that happen outside of your regular nursing home, hospital, acute type environment. And so when we think of long-term care, we're mostly thinking about nursing homes where people live. So it's their home. They have to have basic health care provided, so there are staff there that provide the care, but they're residents. And it's different than being a patient at a hospital. It's your home. It's where your family comes to eat with you, things like that.
Great. Okay. So, yeah, we all may have friends and family that we visited in some of these different types of facilities where they may need some help with their day-to-day care and some additional medical treatments. So I'm going to turn to you, Evelyn, and ask, why is COVID-19 hitting this population so dramatically? Talk to us a little bit about what we know, what are some of the challenges within these settings for infection prevention and control and or the spread of any disease.
Sure, Sylvia, that's a great point. And you've already mentioned, as Angela has as well, I think one of the guiding principles is that residents that are residing in these facilities are often elderly. They have comorbidities or other diseases. It's very rare that you would find a resident with just one medical illness and or problem. And just by the nature of growing older, we have some factors that lend themselves to compromising our immune system or making us less resistant to infections, if you would. Simple things like our decreased ability to cough well, the fact that our skin thins as we age. So those normal barriers that we all have to fight off infection begin to dwindle somewhat when we get older. And I think now especially, as you mentioned, you or Angela mentioned that they have always provided a level of basic medical care, but with COVID-19, they're being expected to provide a level of care that they've never really been prepared for, nor have they had to do that. And some of the challenges are their resources, the availability of resources, staffing resources, even educational resources as it relates to emerging pathogens like this.
So I want to touch on the resources both human and otherwise, because we know that in 2016, the Centers for Medicare and Medicaid issued a rule on requiring these types of facilities around the country, recognizing that different states have different mandates. But in 2016, the Centers for Medicare and Medicaid, also known as CMS, issued a rule requiring a designated infection preventionist. And I know that APIC certainly was on top of that, but that was, even back in 2016, recognizing the need for a more, shall I say, robust infection prevention program because of not just COVID, which didn't even exist back then, but of other healthcare associated infections that we talk about here on the 5-second rule. So we know, going way back 4 years ago and maybe even previously, that there were concerns with these settings. And you mentioned staffing. Can we talk a little bit more about staffing? Angela, do you want to share with us how that typically works with like nurses, nursing aides, movement, and does that contribute to what we're seeing today?
So, I mean, Sylvia, you hit the nail on the head that staffing is a key issue in nursing homes when it comes to the work of infection preventionists. The final rule in 2016 that CMS passed was a good thing because it said we need a designated infection preventionist. But what that really meant was someone took the title of infection preventionist, but maybe didn't have enough resources and training. So often infection preventionists in nursing homes tend to have several other titles such as quality, risk. They might also be employee health, and they might also care for patients. And so in an environment where staff is minimal and the person who does infection prevention is doing lots of other things, sometimes, unfortunately, infection prevention becomes the lowest on the totem pole, such as, if I'm the IT in a nursing home and I'm supposed to be monitoring hand hygiene, if I have coworkers who are sick and I'm employee health, now I've got to work with them on whether they should be at work, how long can they be out. If someone calls in sick, that means I also may start caring for patients. So this is why we've really had to go back to the basics during COVID-19 for infection prevention in nursing homes, because basic things like hand hygiene, environmental cleaning and disinfection, how to use personal protective equipment, and how to follow transmission-based isolation precautions, even just standard precautions. Those all suddenly seem more complicated because the people who do the work don't have enough time to focus on these basic things. They're juggling lots of tasks. And that's contributed to what's happening.
So for everyone out there, I think just to summarize that, even though the rule came about, the people actually serving as infection preventionists or in that role in these settings may not have always had the necessary training or capacity to even address the challenges.
Sylvia, if I could just make one other point.
Sure.
As well, we have to recognize that these facilities are actually the residents' homes. They have had the opportunity to have their families visit as often as they like. They bring their belongings from home. They establish their room as it would be our rooms in our home. And not only that, but the entire environment was focused on joint activities, having joint dining, joint socializing, therapy where there's socialization. And now, unfortunately, all of that has been put on pause because we have visitor restrictions. Residents are requested to remain in their rooms. There's no more joint activities with any of their friends. These are friends that they've made in this facility. So I think we have to remember that as well.
Excellent point, Evelyn. We hear, certainly during the pandemic and even before, resources, but specifically personal protective equipment. I think the audience, again, unless you're living under that rock that I mentioned earlier, PPE refers to those things like gloves, masks, gowns, things that a healthcare worker would need to put on to protect themselves and the resident or patient if you're talking in a hospital. Talk to us a little bit about that PPE resources, respiratory programs, cleaning and disinfection in these settings. Can you shed light on what some of the challenges are?
Sure, Sylvia. So, and I think just to go back to Angela's point again about staffing, the turnover in long-term care facilities is significant. And with a kind of a revolving door like that, it's very difficult to maintain continuity and train staff because you're constantly re-educating and constantly orienting individuals. So this has certainly been a challenge for them as well. And when we talk about personal protective equipment, we're really talking about clothing that's intended to protect the healthcare provider and or personnel. And typically, before COVID, long-term care facilities were using personal protective equipment for things like multi-drug resistant organisms like MRSA. I'm pretty sure, we all have heard about MRSA. But even with that, it was kind of a modified version than what we do if that person is in the hospital. But they had no system set up to really deal with airborne or respiratory pathogens. Up until COVID-19, the biggest concern related to that was tuberculosis, and long-term care facilities did not have to have a fit testing program because they didn't care unless they were designated as a facility that would care for TB patients, and I don't know of a lot of those.
And Evelyn, you're referring to fit testing for an N95 respirator, correct? Just so
correct.
Okay.
Correct. Yes. So it's a face filtering fitted mask that provides a tight seal around the nose and the mouth. So facilities will not provide, because in addition to being fit tested, the facility would also have to have something that we call a room that has negative pressure, which simply means instead of air going from the room to the hallway, it pulls air from the hallway into the room because the air in the room may be contaminated. So we don't want it sucked out into the hallway. So that's why they didn't have the fit testing program, because TB was really the only thing that we were dealing with in that type of a setting. So now they're being expected to do fit testing. You have to be trained in that process. It doesn't just happen. You have to have a trained person. You have to have the supplies available. And then you do have to have the N95 mask. So they kind of came in on the back end of all of that, where a lot of those resources are very difficult to get right now.
So it sounds like we had a perfect storm in these settings where, and then we have a pandemic that hits, and that's why we see these crazy numbers among this population. So, oh my God, there's a lot of problems. And we know people want to do the right thing, right? It's not that people go into work and say, okay, I want to do the worst thing possible. So, I mean, these are their homes. People live in rooms. They have their stuff. We've got certified nursing assistants and other staff in nursing homes that may not be paid, let's just say, adequately and are forced to work multiple facilities. And so we know that there's transmission that way. But I mean, okay, we've just talked about there's so many problems. What can we do? What can infection preventionists do? How do we fix this? Angela?
Sylvia, one of the things because what I try to do, a lot of this seems dismal, but there are some bright spots. There are some things that are happening that make me really happy to see during COVID-19. And one is that we're seeing an increased collaboration across the continuum of care, right? So what that means for me is nursing home staff, hospital staff, surgery center, clinics, and health department folks, they're talking to each other a lot more. In healthcare, we often work in silos thinking about our building. I'm at work for this hospital, this is what I'm doing. But what I've seen is this great sense of collaboration where people working in different healthcare environments in a community are communicating more. And I think that that's a positive for us in the long term, is that we're seeing a lot more working together, if you will.
Angela, I would agree with that. That's, I think APIC is playing a primary role in that as well, encouraging that collaboration, both at the national level and at the state level. And APIC is the Association for Professionals in Infection Control and Epidemiology. So I think we as professionals, it's our responsibility to foster that collaboration and involve long-term care, not just long-term care, but other settings, outpatient settings, dental settings, because as Angela mentioned, these are all our patients, residents, people we're providing care for, regardless of, what term we use to describe them.
So, Evelyn, I'm glad you brought that up. There is one thing I would like to say, because we know that a lot of people listening are infection preventionists like us, but we also know there are a lot of people that are not necessarily infection preventionists, who are listening to this from whatever avenue, riding in their cars to work. And what I would just urge my infection prevention colleagues is that most of us that are members of APIC and really active, most of us work in hospitals, or we are consultants who work in different settings. I would urge all of us to, at your APIC chapter meetings or just within your community, to get to know the infection preventionists that work in the nursing home surrounding your facility. And it's as simple as calling, looking up, the name of the place, dialing. This is what I did when I was in Santa Monica at St. John's Health Center. I would literally look at the names and just call them and say, "Hi, I'm Angela," and introduce myself. And I built some great relationships that way. So I'm hoping we can see more of that continue past COVID-19.
Make a big difference in preventing events like this from happening again.
Well, here on the 5-second rule, we always want to ask our guests what's bugging them about this particular issue. So I'm going to start with you, Evelyn. What's bugging you about all of this?
Well, I think I've already referred to this a little bit, but I really think what's bugging me the most is that long-term care facilities and other settings as well are being expected and asked to do things that they were never, really expected to do before. Some of those things or facilities were never designed to accomplish. So it's very difficult for them to maneuver through an outbreak such as this when they've never really been given the direction, if you would, to do so. So I think they're doing a great job. Long-term care facility staff are doing a phenomenal job with what they have been. They're doing creative things with their residents, drive-bys, birthday celebrations, making bunny masks at Easter. They're just doing so many fabulous things. And I think we have to do everything that we can to support them.
How about you, Angela? What's bugging you about this?
Yeah, I really appreciate what you just said, Evelyn. I think that is such a humane way to look at it. I have such respect for nursing home staff. And I can tell you, in particular, infection preventionists that work in nursing homes, this is not easy work. I mean, people go into this because they believe in it. And so I'd really like to see us, infection preventionists within hospitals and APIC, really support them and embrace them and lift them up, because they're our heroes. This time around, they are our heroes, and they keep going to work every day, which I think is phenomenal, and it's humbling. And so I'd like to see us make them the spotlight of the work that's happening in APIC this year.
Well, we really wanted to shine a light on what is happening in long-term care and in nursing homes. We are just hitting the tip of the iceberg in terms of infection prevention and control in this setting and what APIC members are doing. So stay tuned for future episodes in the long-term care space. Keep in mind, for more information on this topic, visit www.apic.org/free LTC resources. And keep in mind, on the APIC website, you can access the APIC text online free chapters related to long-term care and COVID-19. But with that, I really want to thank both Angela Vassallo and Evelyn Cook for joining us today and providing their expertise. Thanks for joining us.
Thanks for listening to the 5-Second Rule, produced by the Association for Professionals in Infection Control and Epidemiology staff, including Silvia Quevedo and the APIC Communications Committee, in partnership with Human Factor. Audio tech is Blake Alphin.